Hey guys, yep. So what happens in this game? Let me just tell you quickly what happens in this game. You are given an open lot of land with some cash. What is this? This is $100,000 you've given, and you're responsible for starting up a clinic, a hospital. So that's why it's called Project Hospital. So let's just jump in right away. First thing, so yeah, they keep giving you such hints on the left. First thing they want us to do is open an emergency clinic. So what that gives us is it enables contracts with insurance companies, which will give us more patients per se. So yep, let's just start off. The first thing you're supposed to do is, it's an empty lot of land. You can't do much with that. So you first start your construction by laying down the foundations. Let's start with. Oh, I can't speak today. So yeah, let's start with something just adjacent to this parking lot. Uh, let's go for a 20 by 20 foundation for now. That's a foundation. So for an emergency clinic, so this is the emergency department. Now I'll tell you what all you need. The first is a waiting room, doctor's office. So these numbers you see in red are mandatory. So you need a waiting room, you need a doctor's office, you need a restroom, and you need at least one doctor to start off the emergency clinic. So yep, let's start off. What do you want to do? We want to place down our plans. So you don't normally have to do this, but I'm going to start off with the reception. Yeah. So when it's showing the red outline, when the outline is red, it means that the area is small, that we'll have to go a little bigger. There's a minimum size of reception that you can go with, but let me just go for a 6x4 reception. So that's marked out as a reception. Now behind the reception, so what I'm planning for is we'll have a corridor behind the reception, like so. Let's say a 3 wide corridor, and we'll have doctors' rooms, doctors' offices branching off here. That is one doctor's office. We'll have other ones here, but let's just wait for it. Let's just not we just can start off with one doctor's office right now. So that's the doctor's office. Where do we want to put the waiting room? So what I'm thinking is this side of the clinic would be all doctor's offices, and essentially this part would be the emergency department. So we'll get the doctor's offices here, and then we'll have to expand it. And when expansion, I'll tell more about it when we're expanding. But yeah, I have this place marked out for something else. So where were we? A doctor's office is marked out. Let's have a waiting area over here where the patients come in and wait for the doctor to see them. Now that that's done, let's start with the reception here. It says missing equipment and missing staff. Let's take care of the missing equipment part right now. So you click on that, it'll show you what equipment is missing. Now, before placing the equipment, what we're supposed to do is, you just cannot have an open clinic, so we have to construct walls. Where that's in this building mode, you can hit F6 as well. That opens up the options for construction, and the first one is walls. We're going to build some walls to cover the entirety of the clinic. So what I generally go for is a white wall because it looks kind of professional and neat as well. So that's how it's going to be for the start. Yep, this is our basic clinic setup. Now you might notice that the walls are kind of obstructing our view. So for that, we have this option where it auto hides walls. It normally hides all internal walls and leaves up the external walls. The reason this is also hidden is it counts walls that we place on the outside of the foundation as external walls, and only those are shown. So yeah, now that the walls are placed, let's start with to reception. Let's place down items first, whatever is needed, and then we'll go for flooring and other decorations. So the first thing in a reception is you need a place for the receptionist to sit. For that, we'll have to place a counter. Where's the reception desk? Yeah, that's the reception desk. You hit R to rotate it. We place the... Okay, let's do this. Let's put the reception at the side. Just place 2 desks there. And then we'll close it off with that. Now, once you place a desk, you need a chair for the receptionist to sit. When you see these blue arrows, those are kind of jumping up and down. Now you can attach a chair there wherever you place a desk. Once you attach a chair over there, oh my god, it's on the wrong side. I want a chair in the middle. I place a chair there, and you'll have to place a PC, whichever laptop or PC. This is $299, that is $399, and this is $599. I think, yeah, all 3 pieces don't make any sort of difference. All the same, just the cost. They're just for show. So we'll just start off with the $299, the cheapest PC. We'll just place that opposite the chair we put. Now this has become one workplace. Now, along with a PC, they would need a printer, to print out reception receipts or whatever they want, where customers will come, the patients will come and print, pay. So yeah, for that you need a printer. Yep, basically that's a reception. Now it's asking, it says one more place is empty, so we're just going to put another chair and another PC there, but we actually do not need it right now. I think we leave it at 1. That's the reception. Now we're going to place some floors. Here's what I do. I normally go for wooden floors. That's a wooden floor placed. That is done. Now it says it's not accessible and not accessible for patients. Now why does it say that? Because we have walled out everything. Now that obviously needs some doors. Let's just put some sliding doors here for the patients to enter. This is how it looks right now. Oh, we're going to spruce it up a little, so no worries there. And let's just finish designing all of this. Let's place the corridor. The doctor's office is walled up. Now, I'm not going to wall up the waiting area. I'm going to actually join that along with the reception area, but they're 2 separate areas. Now, the waiting area needs chairs and benches for the people to wait for till the time the doctor calls them. So we're going to place some chairs there, right so. And then they need a queue machine. As soon as they come here, they scan this, they enter the details. Once they enter the details, now this is the TV where it shows who the next patient is about to enter. So there's the TV, there's info TV, and of course you should always have some water there for them. Then probably a vending machine for them to pick up some cool drinks. So okay, I'm going to turn the queuing machine this way, because if you place that way, it's going to be blocked. I think it kind of looks cool like this. But this is the waiting area for now. Let's just put some plants in the corner so it looks good. A lamp over here. Some decorations, because the patients, we don't want the patients to get bored when they're waiting. Let's just, where this goes, there is some posters that we can place. There are some posters. Now emergency clinic will have some posters for accidents, about accidents. Obvious, that's one poster we're going to place. And we see you cannot place that there because we already have a lamp there. So we're going to place a poster there for them to read when they're bored. Then we're going to have an info poster there. We'll have a notice board right behind the reception. Okay, seems like we cannot paste it there. The corner facing this way. Alright, so that's the waiting area done. Now let's work on the doctor's office. Now, what does a doctor's office need? Right, again, we'll have to set up a workspace. That's an office desk. 99, 349, 199. I think let's just go for the basic desk. The doctor's desk would be that way. We place a PC on top of that for the doctor and a printer and a chair. We'll give some comfy chairs for the doctors. And that's an office space created. Now the patients are going to come in here, right through here. We're going to stand up here and talk to the doctor, so we'll give them a door there to the patients to come in. Right. Now, they'll need an examination table for when, the patients want to come down and lie down. The doctor will come and examine them. Place that right so. And they need some equipment. What I've seen is generally three equipment tables is more than enough. They have an audiometer which is what they use to detect how good the patient's hearing is, and then we have a CRP scan, which is like it says, it's a quick blood test that the doctor can administer to the patient, and then we'll have an examination lamp right next to the right next to the examination table. And then we need a place for the doctor to wash their hands, and a dustbin, trash bin for you Americans, probably. And then right beside that, we'll have some sanitary equipment, disinfectant dispenser. Right, now that is set up. What else is needed? Now, the doctor would need a chartboard then to properly visualize the patient's conditions. Now, everything that is shown in orange here is mandatory for that particular. So, click on the management mode, click on the room, and then it shows up all the equipment that's needed. Everything that is in white is completely optional. Everything that is in this orange color is mandatory, at least one of that. Now, all four of these are not required. We can place one, all the others will change color. Now, let's place an equipment cabinet here. Probably need it right there. Is that being blocked? Because it's outside, yeah. This should work properly. That's right. And now you need one eye test right opposite the exam table. Now that's done. That's all the setup that we need for a doctor's office. Now let's take care of the flooring. What I generally do is give them dark floors for the office part. And then the examination part. An examination part, I give them white floor. This looks neat. And what I normally do is I give them separation in between. Now this is how it looks basically, but for our visualization purposes we do that. Now that doesn't look good, so I put a glass door for the doctor to enter and make the entirety of this glass separation. So it looks like that. This looks kind of better in my view, and we're all set. We can actually start off. Now something is missing. Right, we've actually placed one more equipment table here. Just want to fill it up with something, just so it doesn't look so bad. What can I think I'll just remove that. Place a bookshelf. Some liquid inside there. Let's see. Yep, let's place an equipment cabinet over there. Yep, and now that's it. Let's cover all the flooring. Yes, flooring. Got the same pattern, yes. All the color is covered. Right. We just cannot start off like this. because we don't have staff. I'll go into the management mode. It shows you can hire 4 staff right now. Now this is for the day shift, this is for the night shift. Same here. Now you can start the clinic without the need of reception as well. But what receptionist does is they chat with the patients and it's kind of a preliminary interview before the doctor talks with the patient, and they bring out certain symptoms that the patient have, which actually saves time with the doctor. So that's the reason I have a reception, and we'll have a doctor's clinic. We'll start off with one of each. Uh, we'll hire we'll hire a day nurse for the reception. Now here is the hiring part. Now all of these are candidates for the receptionist, and they're nurses. Now this is the receptionist page. If you want to hire doctors, you click on that, but right now we're hiring receptionists, so it shows only this part. And this is a level of the receptionist. There are 3 levels. This is, right here, she is second level, let's say. Yeah, she's registered nurse. Level 2 is registered nurse, and level 3 is a nurse specialist. Now, and all of the candidates have a basic salary and hidden qualities. If you want to unhide the hidden qualities, just this button there, hidden perks. Click that. Now let's see which one we want. Wait, this is the cheapest. It's level 2, and she's a fast worker. But we really do not need a fast worker for reception. We just need a good one. Let's see, what is she's a long commute and a germaphobe. A long commute nurse will take a lot of time to come, and that leaves the reception unmanned. James Fernandez is a people person, is a hedonist, is a hard worker. He sounds good. Then we have a pleasant, long commute, and depressed. Now, we're not going for Robert, we'll go for James Fernandez for the day shift. And for the night shift, now we have one more candidate. Let's see what the hidden perk is. Scholar and loyal. Right. So Linda Wright will be a night receptionist. And let's go for doctors. We have 4. Right off the go, I think we'll have to go for Barbara Lewis. She's a fellow. All these 3 are interns. We really don't want to go for interns, because what happens is their patients keep coming back with wrong diagnosis because they're not experienced, right? Interns. So we'll go for a fellow, Barbara Lewis. She's people person, practical diagnosis. Right, it's good. Hedonist, loyal. Now hedonist, now we'll be giving a common room for them. If you give a common room for them, the doctors and other staff are going to spend their free time there, eating, drinking, and whatever. So a hedonist takes longer time there, and which increases patient queues. Right, not right now, but going forward we're going to see a lot of queues. So, but still, I think she's the best candidate we have. I mean, we can completely go for new candidates as well, but right now I think I'll hire Barbara Lewis for the day shift, and for the night shift, see, we have all 3 interns. Now she's an early bird, she is better for the day shift, but I think I'll go for completely new candidates. That is this button here. Is better. Let me see. That's now he's an unpleasant guy. We don't need an unpleasant guy. She's pleasant and long commute. Resident came out. Resting is much faster. Okay, let's go for the resident, Christopher Hernandez, for the night shift. And the whole department needs a chief doctor. Now that is this button here. Barbara Lewis is a more experienced doctor. She is a fellow, so we'll be going with her as a head doctor. Right, and so if we go to the hospital mode, game mode, it still did not open our clinic. Why? The way you can check is, again, now it's flashing the symbol there, caution symbol. The reason that is, we don't have a restroom. Every number in 0 means that it's missing, so we'll have to plan out a restroom as well. Let's go for a restroom, a small restroom here. A 4x4 should do. Some walls. I'll give it a white flooring with white tiles. A door. And then equipment. We need a WC. One over there, two, three. We can have three. And then we'll have a hand dryer right about there. And we need a sink for them to wash their hands there. And we obviously have to place walls between them. So that is just one restroom wall. And a restroom door, a WC door. So this is how it looks. That's restroom. What did we miss? Yep, now the clinic is open overnight. So let's just, the hospital now accepts patients. The hospital now has enough staff to accept those patients. First, insurance companies are automatically contracted. That's this button. So this is the first insurance company which is named uninsured, I think. So once we treat 3 patients, this will get unlocked and keep sending us more patients. So we'll just have to run this. So this is the night shift people going back to their homes. Now, while we wait for patients, let's put in some decorations because all of this looks kind of bland. Let's go for... Right, now this is a prefab button. Now, you saw me build that, but instead of building that, I can just go ahead, just pick this prefab and just place the doctor's office directly. But that's not fun. Probably in late game we'll do that, but that's actually not fun. So, what are we looking for? Decorations, furniture, equipment, decorations, and let's just place some decals. I want to place a pharmacy sign here. And then I'll place a decal. That's good. Now this is the emergency department. Oh, that's okay. This is the emergency department, so let us indicate that as so. This is a waiting lounge. You don't have to do this. Also, while you're in construction, placing any kind of decorations, the game is paused. So you can just do that freely. Where's the symbol for reception? Okay. Yeah. There you go. That's a symbol for reception. I'm going to place a decal over there. And then I have a symbol for a restroom. And hit F5. Let's just wait for first patients to come in. Now, here's what. We don't have patients yet. But here's what's going to happen. Now, the patient's going to come, probably check in the reception. Sometimes they don't. Sometimes they just register themselves for the queue and just wait for the doctor to check them. But what we're going to do, once the first patients come in, we're going to treat them. So let's just speed up till the first patient. Well, there's the first patient. He's going. Peter Walker. Mr. Peter Walker, he didn't go to the right. So here is how the doctor calls for the next patient. He's being called. He's going inside. Now let me pause here quickly. This is a patient's card. Now this is a satisfaction level he has with us, with our hospital. He's 81 years old, retired. This is the insurance company. These are his needs. Now his hunger. If he gets to wait a lot of time, he gets hungry and his satisfaction level drops. And satisfaction level impacts our prestige of the whole hospital. Right now we only have one department here, emergency, but yes, the more number of prestige, more patients come and you make more money. So that is that. He has his 5-star in hunger, but that means his hunger is satisfied with his hunger. His bladder is satisfied, I guess. That's the wrong way to put it. He doesn't have any discomfort. Now, discomfort is increased with certain procedures that you perform, like injections, needles, running an IV, all such. So, and this is his overall satisfaction. Now, we don't know anything about him because it's just 5 hidden symptoms. We don't know anything about him yet because he has not talked to the receptionist. He has directly come and is queuing. So, we don't have any available examinations right now because we do not even know his symptoms. First we'll have to do is talk with him. Doctor has called him. We can actually leave him be controlled by the doctor completely, or we can take control of the patient. Now here we're going to take control of the patient, and just unpause the game. Let's just wait for him to go in. I'm going to turn off the walls here just to see what's happening. I'm going to track so the camera will follow. It's going to the doctor. Now see, this is blinking, it's orange. That means that this examination is being performed. Now the doctor is talking to the patient. Now this will reveal some symptoms. Peter Walker says he has fatigue. This is a prompt that shows that because the patient is player controlled by me, it will give me a prompt every time a procedure is finished. Now he says he has a fatigue. He has experienced fatigue, progressive tiredness from mental or physical exertion or illness. Now these are the available examinations. Now if he's experiencing fatigue, well, we really cannot drill down what he has. His possible diagnosis are all of these. Well, these look serious. This acute renal failure needs dialysis, kidney disease, nephritis, celiac disease. Right, all of these are really serious diagnoses. So we'll have to drill it down to one particular diagnosis. So next logical thing for a patient as a doctor is to have a physical exam. Now this will have the patient sit down on the examination table here. Doctor will come in momentarily, ask him to remove his clothing, and then have a physical examination performed on the patient. That will give us, unhide these hidden symptoms, and we can drill down the diagnosis. So we're just waiting for the physical examination to be done. Right. So he has a headache. Well, that did not reveal much. From what I've seen, he most likely has anemia or sinusitis. Now, we can have a blood test or something like that performed, but we really do not have the department set up yet. So we just perform a chest auscultation. So, which is where, well, there's a second patient coming in. Right, I just skip this. So this guy, Frank Hall, is talking to the receptionist, and that reveals, he told the reception that he has some breathing problems and he wants to, that's why he's in the clinic. So that is how a receptionist helps. We'll have the doctor control him, but let's jump back to our patient, Mr. Peter Walker. So he has sputum cough. It's a productive cough, releasing phlegm from the upper and lower airways. Now that is revealed due to a chest auscultation. The next logical thing, because he has sputum cough, is oral cavity inspection and a nasal cavity inspection. I just check how his mouth and nose look. That will give us more information on him, on his symptoms. Once we reveal these two hidden symptoms, we can say for sure what his diagnosis is. So let's just wait for the doctor to perform these two examinations. Say, that's what they actually hear the patient saying that. So well, this is such an interesting game. This actually gives you, for a person with medical knowledge, I think it should be kind of I don't know, nostalgic for somebody retired, but for people like me, we're here, you see the doctor going there, washing hands, throwing the used gloves there because of the oral cavity inspection. Now she'll come back, Barbara Lewis, right? Barbara Lewis, yeah, we'll come back for nasal cavity inspection. Now, once the examination is happening, the symptoms are being revealed, the possible diagnosis, the percentage of it changes. Now, let's have a quick blood test performed as well. A CRP is C-reactive protein, which actually tells us if there's any infection in the blood. Now nasal cavity inspection is done. Let's check what this will reveal. So it's sinusitis. What sinusitis? Inflammation of the sinuses in the nose, which causes all this. Now these are all the available treatments we can give. Now let's just wait for the CRP to be done as well. Now the patient has a headache, so we'll give him analgesics. to relieve pain. And he has cough. Will wait. What's for cough? Oh, it's a sputum cough, so we'll give him mucolytics, liquid drugs that help to dissolve and clear mucus from the airways. The nasal obstruction, we'll give him nasal spray and nasal drops for nasal congestion, and for fatigue, just have to rest him, man. And we confirm his diagnosis, his sinusitis is final diagnosis. He's going to the doctor, although while 3 patients are being awaiting. So probably we'll need 1 more room and 1 more doctor. Right, so let's just finish off with Mr. Peter Walker. Doctor is prescribing treatments for him. Once these are done, we can send him home. The patients are waiting. We'll have to set up 1 more doctor's office. Like it's printing the prescription. She's printing a prescription, I'm sorry. So yep, that's done. Now we send the patient home. Right. And now I'll need 1 more doctor's office and 1 more doctor. Oh my god, 4 patients waiting already. So how we do that? Now I can go ahead and build everything like I did just before, or I can just go into prefabs, set this button here, copy all of this and just place it right there. Now everything is copied, the walls, the equipment, everything. What we need is another doctor. Let's just hire 2 more doctors for a day shift and night shift. Now what do we have here? We have an attending. I don't want people with long commutes, man. I need new candidates. I have Spartan. He's a good boss, Jordan Scott, but I don't want to make an attending a boss of a fellow. I have a specialist here who looks good. Let's hire him. Good boss, alcoholic, resistance. I don't need alcoholic. He's a Spartan, practical diagnosis, and good boss. I'll hire Casey Davis. Wait, actually, yes, this is for the day shift. I'll hire Jordan Scott, and for the night shift, there'll not be many patients, so I'll just already have a night shift doctor. Okay. Alright, I'll just wait with Jordan Scott. Let's see how the rush is in the night. And then we'll see if we want to hire a new doctor for the night. This is the next patient. We'll see now. We'll see how the doctor diagnoses him. Is going to Jordan Scott. Playing this a little fast. So interview reveals. Wait. See, the doctor is really good. And the interview was good. So he revealed all the symptoms right away. Because it's 100% sure that it's bronchitis, you don't have to do any more examinations. You don't need to know about the hidden symptoms. It's always better to have hidden symptoms checked so that you can give medicines for the hidden symptoms as well. So I think we'll have a physical and chest auscultation ordered for this, so that the doctor will check that, perform that, and reveal the hidden symptoms and prescribe necessary treatments. Because what happens is when you don't address symptoms there, the patients keep coming back, which actually takes a hit on the prestige as well. Let's see what's happening here. Right, so here. Now she has a hand contusion. Now this is the doctor is 100% sure this is a hand contusion. A small bruise on the hand, but there's an available examination here that's grayed out, which is an X-ray upper limb. It's grayed out because we do not have an X-ray room and we do not have a technologist hired. Right now, we do not need this for this patient because it's just a contusion. So I think we'll hold off. We do have the money, but I think we'll hold off, till there arises a need. Let's check this patient. So the triage actually revealed that she has chest pain and breathing problems. Chest pain is something serious. Now the symptoms, sometimes they are blinking. Let's see if somebody has. Not right away. The symptoms are sometimes blinking, red. Right, like this. Weakness. Did it just blink? So what happens is, symptoms when they're red and they're blinking, they might cause a collapse. Right now, the game doesn't do that because we do not have a trauma department. But yeah, once they collapse, the patients also collapse, and there's also possibility of them dying. So uh, when this happens, we'll have to have a a room for trauma patients like that ready, and a general ward where they can be put under observation. But right now, I think it's not required. We'll go there. Uh, there's James Hernandez taking a dump. Okay, let's see what's wrong with her. Chest pain, breathing problems. No, we'll just take care of. Right. So, insurance company can be contracted. Let's go to insurance management. Let's contract this company. Right. It gives us a 30,000 government grant if we treat 10 patients per day. So we are treating 30 for now. So this will increase. Once we get that, we get a $30,000 government grant, and we'll expand, I think, with one more doctor's office. And we'll start off with a radiology department with x-rays, and then we'll put up a pharmacy store right here. So that's all for now, guys. If you like the stream, if you like me, if you want to see more of these videos, do like and subscribe. Drop a comment down below if you want to add a suggestion for me. This is the first video I'm doing, this first game I'm recording. Just let me know if you like this, and probably I can come up with more videos. Until next time, guys, see you. Bye bye.